Hi, my name is Taylor Bitfield, and today I'm going to inform you on a hearing impairment. Marion Ross on Happy Days said, "The thing about a hearing loss is that no one can see it. You cannot simply look at a person and tell that they have a loss. Most people are so impatient and they just assume that the person is being rude, or they may even think that the person is slow-witted, when in fact they just cannot hear." About 2 to 3 of every 1,000 children in the United States are born deaf or hard of hearing. Approximately 188,000 people worldwide have received cochlear implants. Now I'm going to inform you about the characteristics, causes, and treatments for a hearing impaired person. Some of the characteristics of having a hearing loss is that it can make understanding speech very difficult. Hearing impaired people sometimes have an atonal voice, which is a lack of tone or delayed speech. This can make communication between peers difficult. They can also have a difficult time socializing and fitting into the social norms, which can cause feelings of loneliness, isolation, and sometimes frustration. Many times, hearing impaired people rely on lip reading, sign language, or other forms of communication. These characteristics may only affect some of the hearing impairment population. Not all will have these characteristics. Next, I'm going to inform you about the causes of a hearing impairment. Hearing impairments can either be acquired, meaning that the loss occurred after birth due to an illness or injury, or it can be congenital, meaning that the deafness was present at birth. Some acquired causes are from too much exposure to noise, a buildup of fluid in the eardrum, or even ear infections, childhood diseases such as chickenpox, or lastly, head trauma accidents. Congenital deafness can occur from family history of hearing loss, infections during pregnancy, or complications during pregnancy such as the HR factor or maternal diabetes. There are two causes of hearing impairment. These causes are either acquired, which are obtained, or congenital, which are present at birth. The last thing I'm going to inform you about are the treatments available for hearing impaired people. These treatments vary from patient to patient and depend on many factors. Treatments for hearing impaired individuals varies depending on how severe the hearing loss is. There are also medications available for people in order to help with ear infections or the buildup that causes the hearing loss. Surgery is another option treatment for some people. The middle bone in the ear sometimes is the causes of the problem, and they can be treated with surgery. Hearing aids are also very beneficial for hearing impaired individuals. Cochlear implants are also allow an individual to hear and understand more, but does not completely fix hearing problems. In conclusion, hearing problems do not have all the same characteristics, causes, or treatments that will work for an individual. It varies from person to person. Some of the characteristics include the following: an atonal voice or different forms of communication such as sign language. The causes of hearing impaired are either congenital, present at birth, or acquired, which are developed. There are many different treatments options available for hearing impaired people. One example that I talked about were hearing aids. This allows patients to hear better but does not completely fix the hearing loss all in all. In conclusion, like Marion Ross said, a hearing impaired person is not slow-witted, but they simply cannot hear. So the next time you learn that someone has a hearing problem, take some extra time to understand them and let them know that you care. Thank you.